Well, I have to say, it may sound like I'm playing to my board member, but JU is incredibly blessed to have Rick Mullaney and to have President Cost here. The talent level that was brought to this university is just amazing, and Jacksonville is blessed to have them. Let me touch on, I'm going to digress for just a minute before I get started to follow up on something that you talked about. I think one thing that will offset to some extent the shortage of primary care providers is that as we move into this new era of our approach to healthcare, we're going to be looking to require those that are providing care to perform at the top of their training, at the top of their licensure. So for the nurses and the nurse practitioners in the community, I just came from seeing a CareMore clinic out in California, spent some time there a couple of weeks ago, and what you see is nurse practitioners performing a lot of the activities that some traditional primary care physicians have provided. And primary care physicians then are performing a lot more of the activities that have been sent off to specialists in the past, because they're trained. If they're performing at the top of their licensure, at the top of their training, they can provide a lot of these services, and even medical assistance, providing a lot of things that in a lot of communities would be seen handled by nurse practitioners. So I think a lot of that will help to offset the shortage that we'll see. St. Vincent's Healthcare is committed to the care of all persons, regardless of their level in life, whether they're poor or vulnerable. We are committed to the care of all persons. And I'd have to say that all the folks up here at the front table are today. Our commitment at St. Vincent's Healthcare is backed by our Catholic values, which put great importance in the sanctity of life and in the inherent dignity of each person, regardless of whether they're employed or unemployed, whether they're at all ages, from conception to death, whether they are rich or poor, whether they are sick or healthy. Everyone has inherent dignity and the right to getting health care. And so we are supportive of that aspect of this very flawed bill. We're very supportive of the aspect that we are trying to get care to all those in need. We're also supportive of the concepts that improve the approach to care, so that we're working toward value and improving outcomes for individuals and allowing you to live at your best health. Now, having said all of that, we're going to talk a little bit about expansion of coverage for the poorest in our community. We heard earlier quite a bit of commentary about the expansion of Medicaid. Let me emphasize that from our vantage point, it does not have to be Medicaid that we expand, but we want meaningful expansion of coverage, not just something that gets by, but meaningful expansion of coverage that meets the expectations of the federal government. And I would love for us to have meaningful negotiation with them to allow a plan for the state of Florida. I think all of us support that. But we want meaningful expansion of coverage. And what you see here is a chart that displays the number of people in different categories that will be covered if we expand coverage at the levels that have been requested by the federal government. And the largest group that will get coverage that doesn't currently have it would be adults. There's be adults that are not pregnant women. And so that's the big red bar that you see on the right there, the childless adults. And, you know, I've heard plenty of folks talk about the fact that maybe we shouldn't cover the population that doesn't have a job. And I want to touch on that for just a minute as well. 77% of the uninsured are employed. And they're people that we all depend on. We are all depending on all of those occupations that you see up on the screen right now. So it's important that we not discount their value economically to our community. Certainly not to mention the inherent dignity that we believe each person holds. And as you can see here, there are a lot of other issues that go along with not covering this population. You heard earlier that there was no discernible difference between those that were on Medicaid and those that weren't. Well, let me, according to a report that we heard about earlier, let me mention something to you about Medicaid beneficiaries. For most of you in this room, you are either on your parents' policy, or you're on Medicare, or you're on your employer's policy, for most of the people in this room. So you have that policy whether you are ill or healthy. But Medicaid beneficiaries tend to only apply for coverage when they are sick, when they're in the hospital, or when they're pregnant. And so we have adverse selection. That comparison is not a fair comparison. If you're looking at people that are on Medicaid, they tend to be sick people. And so you can't really compare them to the normal commercial insured population. And so you can see many of the costs that impact us as a result of not covering people. And we are going to pick up that tab in one way or another. You can see that on the screen as well, that we're picking up that tab through a variety of different possibilities, whether it's through the employers having to pick up the uninsured cost, whether hospitals are picking it up, or whether it's borne in the rates that are demanded through the Medicare and Medicaid program for the health systems and providers in our community. Medicaid has had shared financial support from the federal government for almost 50 years. And right now we're at a 58-42% split with the federal government. It's worthy of note, you saw earlier, and so I'm going to skip through it very quickly, that Jim talked about how that will stair-step down. It is important to note that states can opt out later if they are not satisfied with the program, if the federal government withdraws their support. Now, I don't want to suggest, and Representative Cummings is sitting here, I don't want to insult his intelligence and suggest that that would be easy, and maybe even impossible to withdraw that support once it's put out there. But it is an option. And I think what's important also is that we accept federal funds for all kinds of programs. In fact, I Googled it, as many of us would do, and I saw that there are about 2,000 programs that states get support from the federal government. So it's not unusual, and nor are we normally shy about taking government funds in the states. I think one of the most important things I want to say is that for all the business leaders in this area, you know that true innovation occurs when you pull somebody out of operations and have them focus on implementing innovation, and when you set aside funding for innovation. In healthcare today, we are being asked to make major innovation in the way we approach care. We cannot do that without funding. Right now, you saw this morning from Ford Coles the downward stair step of funding for hospitals through the Medicare and Medicaid programs, the reductions in our funding. How in the world are we supposed to change our model of care, which drives down our volume in a fee-for-service model, to a value model without funding? This will draw $51 billion in federal funds, and in fact, the sales and tax revenues in the state of Florida that are generated from the investment of this capital will exceed the cost increase for the program. So it seems clear to me that this is a great economic opportunity. It also comes with jobs. It's an estimate that 121,000 jobs will be added across the state of Florida if we infuse $51 billion in capital over the next 10 years. And those jobs will come to our community here. Northeast Florida, the estimate is 6,200 jobs in St. Johns, Clay, and Duval County. And it's in all kinds of categories. Of course, the majority will be in hospitals and physician offices and healthcare providers, but a significant portion will be in a lot of the businesses that we depend on every day in this community. And I probably don't need to mention that the hospital providers that you see here today, 4 of them represent the top 10 employers in the Northeast Florida area. So it is a significant impact on our community to make sure that we keep healthy healthcare systems in our community. It's a big part of our economy. So what happens if we opt out? Well, then we obviously don't draw down these funds that we have paid into. And I saw one quote that no, you're not bringing our money back home, because we can't even afford all the things that the federal government is spending money on. But I would tell you that I can't control everything that the federal government is spending money on, but we have more control over what is done in our state. And bringing that capital infusion home to our state can make a big difference to our economy. Also, we have this loss of DISH that you're going to hear about in a little bit as well that hurts us. Without the expansion, the program doesn't work very well if we pull out the poorest. And by the way, we heard also earlier that we should allow people that from 100% to 138%, they can buy off the exchange. Well, that is true. They have a 40% copay in the bronze product and a significant deductible. So how many people that make $10,000 a year will be able to pay the 40% copay and the enormous deductibles that are in this program? I'm not suggesting that people at 150% of the federal poverty level can afford it either, but certainly the people at lower income levels can't afford it. You can read the rest. I won't take time to go through them all because we have more speakers to come. This is just a reiteration of the points I'm making. A lot of jobs to our economy, important capital infusion to our state. It is a good business decision for us to expand coverage in a meaningful way. It doesn't have to be Medicaid, but expand coverage in a meaningful way so that we can draw down these funds and so that we can respect the inherent dignity of all of our citizens. Thank you very much.
Thank you so much, Moody.